Hey guys, it's Dr. Justin Marchegiani. Really excited to be here today. We're going to chat about the top 3 reasons you may get a UTI, a urinary tract infection. Excited to talk to you about this topic. I see lots of patients with UTIs every week. It's a common thing I see. We're going to dive into that and kind of review top ways that we can make that happen. We can fix that issue. Tend to see UTIs more in females. We'll go over that. And also, real quick, make sure you subscribe to the YouTube channel as well. Make sure you get access to live videos like this and put your comments down below. Love to see, love to get a hold of what you guys think and what you think about some of the suggestions I'm putting out there. So regarding urinary tract infections, so with guys in general, typically urinary tract infections from the urethra, typically you don't see them in guys as much. You can have them. Again, urinary tract infections can spread upstream through the urethra into the bladder and then eventually go to the kidneys. There's quite a big distance for guys going from the urethra into the urinary tract, into the bladder, and up to the kidneys, much farther. Women have a much shorter distance of tubing, so bacterial infections are much easier to spread. Big reason why women are more prone is you're going to have a greater risk after sex. So after intercourse, there's greater chance of bacteria from the semen and such to kind of hang out, stay in that cavity, especially if you don't get up and urinate and kind of flush everything out. There's that as a increased risk. Number 2, just an increased risk if you have imbalance in your vaginal flora, imbalance in your vaginal pH. pH is a big thing that prevents bacteria and yeast from growing. So if you have low levels of beneficial bacteria, you're on birth control pills, things like that, that pH may be a little bit higher and a little bit more into the alkaline range, and that may make it easier for bacteria to grow. Remember, beneficial bacteria actually produce acid. If you look at the Latin translation of Lactobacillus acidophilus, it literally translates to acid loving. So beneficial bacteria actually produce acid, and they can shift the pH a little bit and make it harder for bugs and bacteria to grow. Again, the biggest, most common bacteria for UTIs are going to be E. coli. E. coli is the most common one. With BV, you're going to see more Gardnerella. That's the kind of bacterial overgrowth in the vaginal area. Urinary tract is going to be specific to the urethra and the urinary tract. Again, Gardnerella does produce that potassium hydroxide. That's where you're going to get that fish odor from. Urinary tract, you're going to notice more just that burning, that urinary urgency, where the vaginal itch or vaginal pain and vaginal odor will be more for the BV. So you can kind of differentiate those. And then a yeast infection, again, it can feel similar to the BV. The typical distinction will be the odor most of the time. And then also you can get like a Monistat pH test and you can see if that's off as well. You can also get a culture, see if there's any bacteria or yeast present as well. I would say the biggest difference would be yeast, you tend to have a little bit more discharge. You could with BV. I think the big thing would be the differentiating odor. That'd be the big thing out of the gate. And also the itchiness. You can have both. So there can be an overlap. You may need a culture or a swab if you can't quite figure it out. So regarding urinary tract issues, first thing is intercourse. That increases susceptibility. Second thing is going to be pH. And so if we have imbalance in the pH due to bacterial imbalances, antibiotic use, birth control pills, that can throw the pH off, and that can make it easier for the bad bugs to grow. And so antibiotics, birth control pills, all those things I think are big things. And of course, just extra processed food. The more processed junk you eat, right, that can throw off the microbiome in the gut. It definitely can have an influence in the vaginal microbiome, right? Processed sugars, processed grains, anything that's going to be acellular processed, that's going to feed dysbiotic bugs, whether it's yeast, whether it's bacteria. These are different things that would be driving factors. Now, you can differentiate it with like a Monistat swab that can tell you if the pH is off and if you're more likely to have a yeast issue. If you're on the fence, you can always do a urinalysis, and they'll check for bacteria, white blood cell esterase to look at pH and such. They can also do a swab, and they'll see if it's bacteria-based, so you can do a swab for that. And again, usually the Monistat will kind of tell you on the yeast side. It's a pretty good at-home test. And then the urine culture will tell you more on the BV or UTI side, because typically you'd be able to, well, usually the urine culture is going to be more on the urinary tract, where a vaginal swab would be more on the BV side. Just an FYI on that. Now, again, natural things we can do is just one, add in probiotics. One of the best things we can do for vaginal health is like the L-Reuteri species is excellent. So L-Reuteri is very good. You can easily mix some like Greek yogurt, and you can insert intravaginally. Making sure you're hydrated, getting enough water plays a big role because that way you're constantly urinating and then you're kind of passing the E. coli that's in that urinary tract. You're pushing some of it out. You can also add in things like D-mannose because E. coli loves the D-mannose sugar. D-mannose is a sugar that's very big, so it goes out in the urine. You don't really absorb it and put it in your bloodstream and burn it. It's bigger, so it goes out in the urine. And then typically, as it passes out the urinary tract, the E. coli kind of grab onto it. And as that D-mannose is flowing by, the E. coli are grabbing onto it and going out in the toilet. So D-mannose can be excellent, very helpful. Parsley can be very good. I'll even use a little bit of apple cider vinegar or cranberry juice. You can add like a little bit in some water and you can drink that. You can do 4 ounces of raw, no sugar added organic cranberry juice. You can add some water or do it straight if you get all the taste. That's very good. You can also do uva ursi. I'll have a tincture that I use with old man's beard, uva ursi, burdock, different berberines that can be very helpful. I'll even do some silver. Silver can be great because it will go through the urinary tract, and as it flows through, it does have an antimicrobial, antibacterial effect. So that's really good as well. So we have the hydration, we have the different D-mannose, the different herbs, the uva ursi, we have the silver. We can add in some probiotics even intravaginally. We can mix it in either like a little bit of shea butter, or we could add it in a little bit of coconut oil. You could add some to the coconut oil and then freeze it and then insert intravaginally. You can mix it in with some Greek yogurt. That's totally fine as well. Those would be the big things out of the gates. People ask, what are your symptoms of catching a UTI? A big one's going to be burning on urination. Burning on urination is going to be the big one with a UTI. With BV, it'll be just more global itchiness and odor. And then yeast, you'll typically have more of a discharge on the yeast, but it can mimic BV. It can mimic BV. So you may need to get a Monistat or a swab or a culture and see how you do. You may even want to just try some of these natural treatments and see if it goes away. And that kind of gives you confirmation if you're on the right track. So hope that makes sense. But again, hydration, good healthy bacteria in the urinary tract, in the vaginal canal. You can even take things orally or even insert intravaginally. You can really make sure hydration's dialed in. You can make sure you are doing good healthy foods that are not going to feed the dysbiotic bacteria. And then you can work on some of the different herbal tinctures that I mentioned below. In my line, we use GI Clear 3. That'd be one that I would use as well. I would even say you could even do like the GI Clear 4 with the golden seal in there. Golden seal works phenomenal as well. And I have a urinary tract tincture. It's a special order product, but if you I'll put it down below. I'll put a link down below for it so you guys can find it. I hope that helps. If you guys enjoyed today's video, feel free and click down below. There'll be links to my coordinates where you can get a hold of me. I see patients functional medicine-wise worldwide. Again, if you have vaginal imbalances, there's probably more issues upstream in the gut. So you may want to look deeper in that area, especially if you have imbalances in digestion and motility. It's good to look upstream as well. Again, if you enjoyed today's video, put your comments below. Let me know what you think, and you guys have a phenomenal day. Take care, y'all. Bye now.